Hi everybody, this video of mine is about clinical depression. This is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities and sometimes you may feel as if life is not worth living. More than just a bout of the blues, depression is not a weakness and you cannot simply snap out of it. Depression may require long-term treatment, but do not get discouraged. Most people with depression feel better with medication, psychotherapy, or both. Now I'll tell you the symptoms. Although depression may occur only once during your life, people typically have multiple episodes. During these episodes, symptoms occur most of the day, nearly every day, and may include feeling of sadness, tearfulness, emptiness, or hopelessness, angry outburst, irritability or frustration even over small matters, loss of interest or pleasure in most or all normal activities such as sex, hobbies, or sports, sleep disturbances including insomnia or sleeping too much, tiredness and lack of energy, so even small tasks take extra effort, reduced appetite and weight loss or increased cravings for food and weight gain, anxiety, agitation or restlessness, slowed thinking, speaking or body movements, feelings of worthlessness or guilt, fixating on past failures or self-blame, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide, unexplained physical problems such as back pain or headaches. For many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities such as work, school, social activities, or relationships with others. Some people may feel generally miserable or unhappy without really knowing why. And I'll tell you depressive symptoms in children and teens. Common signs and symptoms of depression in children and teenagers are similar to those of adults, but there can be some differences. In younger children, symptoms of depression may include sadness, irritability, clinginess, worry, aches and pains, refusing to go to school, or being underweight. In teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive. They may use recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interactions. Now I'll tell you depression symptoms in older adults. Depression is not a normal part of growing older and it should never be taken lightly. Unfortunately, depression often goes undiagnosed and untreated in older adults, and they may feel reluctant to seek help. Symptoms of depression may be different or less obvious in older adults, such as memory difficulties or personality changes, physical aches or pains, fatigue, loss of appetite, sleep problems, or loss of interest in sex, not caused by medical condition or medication. Often wanting to stay at home rather than going out to socialize or doing new things. Suicidal thinking or feelings, especially in older men. If you feel depressed, make an appointment to see your doctor or mental health professional as soon as you can. If you are reluctant to seek treatment, talk to a friend or loved one, any healthcare professional, a faith leader, or someone else you trust. If you think you may hurt yourself or attempt suicide, call 911 or your local emergency number immediately. Also consider this option if you are having suicidal thoughts. You should call your doctor or mental health professional or call a suicide hotline number in your respective country. Reach out to a close friend or loved one. Contact a minister, a spiritual leader, or someone else in your faith community. Coming to the causes of depression, it's not known exactly what causes depression. As with many mental disorders, a variety of factors may be involved, such as biological differences. People with depression appear to have physical changes in their brain. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with neurocircuits involved in maintaining mood stability may play a significant role in depression and its treatment. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks or months after delivery, that is known as postpartum. And from thyroid problems, menopause, or a number of other conditions. I have also made a video on hypothyroidism, which you can see in this channel. Hypothyroidism may also cause depression. Another cause could be inherited traits. Depression is more common in people whose blood relatives also have this condition. Researchers are trying to find genes that may be involved in causing depression. Now I'll tell you some risk factors. Depression often begins in the teens, 20s or 30s, but it can happen at any age. More women than men are diagnosed with depression, but this may be due in part because women are more likely to seek treatment. Factors that seem to increase the risk of developing or triggering depression include certain personality traits such as low self-esteem and being too dependent, self-critical or pessimistic. Traumatic or stressful events such as physical or sexual abuse, the death or loss of a loved one, a difficult relationship, or financial problems. Blood relatives with a history of depression, bipolar disorder, alcoholism, or suicide. Another risk factor is being lesbian, gay, bisexual, or transgender, or having variations in the development of genital organs that are not clearly male or female, intersex, in an unsportive situation. History of other mental health disorders such as anxiety disorder, eating disorder, or post-traumatic stress disorder. Abuse of alcohol or recreational drugs, serious or chronic illness including cancer, stroke, chronic pain, or heart disease. Certain medications such as some high blood pressure medication or sleeping pills. You should talk to your doctor before stopping any medication. So these are the risk factors for depression. Now I'll tell you the complications of depression. Depression is a serious disorder that can take a terrible toll on you and your family. Depression often gets worse if it is not treated, resulting in emotional, behavioral, and health problems that affect every area of your life. Here I'll tell you some examples of complications which are associated with depression. Excess weight or obesity, which can lead to heart disease and diabetes. Pain or physical illness, alcohol or drug misuse, anxiety, panic disorder or social phobia, family conflicts, relationship difficulties and work or school problems, social isolation, suicidal feeling, suicide attempts or suicide, self-mutilation such as cutting, premature death from medical conditions. Now I'll tell you some preventive measures. There is no sure way to prevent depression. However, there are some strategies which I am going to tell you. These might help. You should take steps to control stress, to increase your resilience and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you weather rough spells. Get treatment at the earliest sign of a problem to help prevent depression from worsening. Consider getting long-term maintenance treatment to help prevent a relapse of symptoms. Coming to the diagnosis of depression, when patient come to us, we may determine a diagnosis of depression based on symptoms, which I told you, and physical exam. Your doctor may do a physical exam and ask questions about your health. In some cases, depression may be linked to an underlying physical health problem. As I told you, hypothyroidism and some other medical conditions can lead to depression. Lab tests. Sometimes we may advise some lab tests to rule out any medical condition. As I told you, the hypothyroidism or other medical condition, we may ask for a complete blood counts and test your blood. And also, as I told you, that we can take tests for thyroid to make sure it is functioning properly. Psychiatric evaluation. Your mental health professional asks about your symptom, thoughts, feeling, and behavior patterns. You may be asked to fill out a questionnaire to help answer these questions. Now, the criteria for diagnosing depression is known as DSM-5. Your mental health professional may use the criteria for depression that is listed in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by American Psychiatric Association. Now I'll tell you the types of depression. Symptoms caused by major depression can vary from person to person. To clarify the type of depression you have, your doctor may add one or more specifiers. The specifiers mean that you have depression with specific features such as anxious distress, depression with unusual restlessness or worry about possible events or loss of control. Then the depression may come with mixed features. Simultaneous depression and mania, which includes elevated self-esteem, talking too much, and increased energy. Melancholic features. Severe depression with lack of response to something that used to bring pleasure and associated with early morning awakening, worsened mood in the morning, major changes in the appetite and feeling of guilt, agitation or sluggishness. There is another type, that is depression with atypical features. Depression that includes the ability to temporarily be cheered by happy events, increased appetite, excessive need for sleep, sensitivity to rejection, and a heavy feeling in the arms or legs. There is a depression with psychotic features also. Depression accompanied by delusions or hallucinations, which may involve personal inadequacy or other negative themes. Catatonia. This is a depression that includes motor activity that involves either uncontrollable and purposeless movement or fixed or inflexible posture. Peripartum onset. Depression that occurs during pregnancy or in the weeks or months after delivery, that is postpartum depression. And there is a depression which is associated with seasonal pattern, and that is also known as seasonal affective disorder, SAD. Depression related to changes in season and reduced exposure to sunlight. Okay. There are some other disorders that cause depression symptoms. Several other disorders, such as, which I tell you now, include depression as a symptom. It is important to get an accurate diagnosis so you can get appropriate treatment. Bipolar 1 and 2 disorders. These mood disorders include mood swings that range from highs, that is mania, to low, that is depression. It is sometimes difficult to distinguish between bipolar disorder and depression. Cyclothymic disorders. Cyclothymic disorder involves highs and lows that are milder than those of bipolar disorder. Then there is a depressive mood dysregulation disorder. This mood disorder in children includes chronic and severe irritability and anger with frequent extreme temper outbursts. This disorder typically develops into depressive disorder or anxiety disorder during the teen years or adulthood. Persistent depression disorder, sometimes called dysthymia. This is a less severe but more chronic form of depression. While it is usually not disabling, persistent depressive disorder can prevent you from functioning normally in your daily routine and from living life to its fullest. Premenstrual dysphoric disorders. This involves depression symptoms associated with hormone changes that begin a week before and improve within a few days after the onset of your periods, and are minimal or gone after the completion of your period. Other depression disorders. This include depression that is caused by the use of recreational drugs, some prescribed medication, or other medical conditions which I mentioned before. Now coming to the treatment of depression. Medications and psychotherapy are effective for most people with depression. Your primary care doctor or psychiatrist can prescribe medication to relieve symptoms. However, many people with depression also benefit from seeing a psychiatrist, psychologist, or other mental health professional. If you have severe depression, you may need a hospital stay, or you may need to participate in an outpatient treatment program until your symptoms improve. Now, I'll tell you some of the medications. Many types of antidepressants are available, including which I tell you now. Be sure to discuss possible major side effects with your doctor or pharmacist. Okay, the first group of drugs are known as selective serotonin reuptake inhibitors, that is SSRIs. Doctors often start by prescribing an SSRI. These drugs are considered safer and generally cause fewer bothersome side effects than other types of antidepressants. And these include citalopram, that is coming with the name of Lexapro, fluoxetine, that comes with the name of Prozac, paroxetine, Paxil, sertraline, Zoloft, this is the trade name for sertraline, and some others. And another group of drugs is known as serotonin norepinephrine reuptake inhibitors, that is SNRIs. The examples of these drugs include duloxetine, that comes with the name of Cymbalta, and venlafaxine, that is coming with the name of Effexor, and some other drugs. Now, there is a group of atypical antidepressants. These medications do not fit neatly into any of the other antidepressant categories. They include bupropion, valproate, epinephrine, mirtazapine, nefazodone, trazodone, and some others. Another group is tricyclic antidepressants. These drugs such as imipramine, that comes with the name of propranolol, nortriptyline, amitriptyline, doxepin, and protriptyline can be very effective but tend to cause more severe side effects than newer antidepressants. So tricyclic antidepressants generally are not prescribed unless you have tried an SSRI first without improvement. Monoamine oxidase inhibitors, MAOIs, such as phenylcypromine, Parnate, which comes with the name of Parnate, phenelzine, and others may be prescribed typically when other drugs have not worked because they can have serious side effects. Using MAOIs requires a strict diet because of dangerous or even deadly interactions with foods such as certain cheeses, pickles, and wines, and some medications and herbal supplements. Salicyline, a newer MOI that sticks on the skin as a patch, may cause fewer side effects than other MOIs do. These medications cannot be combined with SSRIs. Other medication may be added to an antidepressant to enhance antidepressant effects. Your doctor may recommend combining two antidepressants or adding medications such as mood stabilizer or antipsychotics. Anti-anxiety and stimulant medication also may be added for short-term use. If a family member has responded well to an antidepressant, it may be one that could help you. Or you may need to try several medications or a combination of medications before you find one that works. This requires patience as some medication needs several weeks or longer to take full effect and for side effect to ease as your body adjusts. Inherited traits play a role in how antidepressant affects you. In some cases where available, results of genetic tests done by blood tests or cheek swab may offer clues about how your body may respond to a particular antidepressant. However, other variables besides genetics can affect your response to medications. And there are risks of abruptly stopping medication. Do not stop taking an antidepressant without talking to your doctor first. An antidepressant are not considered addictive, but sometimes physical dependence, which is different from addiction, can occur. Stopping treatment abruptly or missing several doses can cause withdrawal-like symptoms, and quitting suddenly may cause a sudden worsening of depression. Work with your doctor to gradually and safely decrease your dose. Now I'll tell you something about antidepressant and pregnancy. If you are pregnant or breastfeeding, some antidepressant may pose an increased health risk to your unborn child or nursing child. Talk with your doctor if you become pregnant or you are planning to become pregnant. Antidepressants and increased suicide risks. Most antidepressants are generally safe, but the Food and Drug Administration (FDA) requires all antidepressants to carry a black box warning, the strictest warning for prescriptions. In some cases, children, teenagers, and young adults under age 25 may have an increase in suicidal thoughts or behavior when taking antidepressants, especially in the first few weeks after starting or when the dose is changed. Anyone taking an antidepressant should be watched closely for worsening depression or unusual behavior, especially when starting a new medication or with a change in dosage. If you or someone you know has suicidal thoughts when taking an antidepressant, immediately contact a doctor or get emergency help. Keep in mind that antidepressants are more likely to reduce suicide risk in the long run by improving mood. Okay, the next comes psychotherapy. This is a general term for treating depression by talking about your condition and related issues with a mental health professional. Psychotherapy is also known as talk therapy or psychological therapy. Different types of psychotherapy can be effective for depression, such as cognitive behavior therapy or interpersonal therapy. Your mental health professional may also recommend other types of therapies. This psychotherapy can help you adjust to a crisis or other current difficulty, identify negative beliefs and behaviors and replace them with healthy, positive ones, explore relationships and experiences and develop positive interactions with others, find better ways to cope and solve problems, identify issues that contribute to your depression and change behaviors that make it worse, regain a sense of satisfaction and control in your life, and help ease depression symptoms such as hopelessness and anger. Learn to set realistic goals for your life. Develop the ability to tolerate and accept distress using healthier behaviors. So these are the advantages of psychotherapy which I just told you. There are some alternative formats for therapy. Formats for depression therapy as an alternative to face-to-face office session are available and may be an effective option for some people. Therapy can be provided, for example, as a computer program, by online session or using videos or workbooks. Programs can be guided by a therapist or be partially or totally independent. Before you choose one of these options, discuss these formats with your therapist to determine if they may be helpful for you. Also, ask your therapist if he or she can recommend a trusted source or program. Some may not be covered by your insurance, and not all developers and online therapists have the proper credentials or training. Smartphones and tablets that offer mobile health apps such as sport and general education about depression are not a substitute for seeing your doctor or therapist. And I'll talk about hospital and residential treatment. In some people, depression is so severe that a hospital stay is needed. This may be necessary if you cannot care for yourself properly or when you are in immediate danger of harming yourself or someone else. Psychiatric treatment at a hospital can help keep you calm and safe until your mood improves. Partial hospitalization or day treatment programs also may help some people. These programs provide the outpatient support and counseling needed to get symptoms under control. There are some other treatment options which I must tell you. For some people, other procedures, sometimes called brain stimulation therapies, may be suggested. These include electroconvulsive therapy, that is ECT, In ECG, electrical currents are passed through the brain to impact the function and effect of neurotransmitters in your brain to relieve depression. ECG is usually used for people who do not get better with medications, or they cannot take antidepressant for health reasons, or are at high risks of suicide. Another mode of treatment is transcranial magnetic stimulation, that is TMS. This may be an option for those who have not responded to antidepressant. During TMS, a treatment coil placed against your scalp sends brief magnetic pulses to stimulate nerve cells in your brain that are involved in mood regulation and depression. Now I'll tell you some lifestyle and home remedies. Depression generally is not a disorder that you can treat on your own, but in addition to professional treatment, these self-care steps can help, which I'm going to tell you. You should stick to your treatment plan. Do not skip psychotherapy sessions or appointments, even if you are feeling well. Don't skip your medication. If you stop, depression symptoms may come back. Do not stop medication without asking your doctor, okay? Because depression symptoms will come again, okay? And you could also experience withdrawal-like symptoms. Recognize that it will take some time to feel better. As I told you previously, depression takes weeks or months to start showing their, antidepressant drugs start showing their effects after weeks or months. So you should be patient, okay? You should learn about depression. Education about your condition can empower you and motivate you to stick to your treatment plan, and encourage your family to learn about depression to help them understand and support you. For example, now I am making this video on depression, so this video can be very helpful for all depressive patients, or if you are having any patient in your family, you should show this video of mine, and so that he or she can learn about depression. Also, pay attention to warning signs. Work with your doctor or therapist to learn what might trigger your depressive symptoms. Make a plan so that you know what to do if your symptoms get worse. Contact your doctor or therapist if you notice any changes in symptoms or how you feel. Ask relatives or friends to help watch for warning signs. Avoid alcohol and recreational drugs. It may seem like alcohol or drugs lessen depression symptoms. Because some people, what they think that if they drink alcohol or some recreational drugs, they can reduce their symptoms, but this is wrong. And because in the long run, they generally worsen symptoms and make depression harder to treat. You should talk with your doctor or therapist if you need help with alcohol or substance abuse. Take care of yourself. You should eat healthy diet, be physically active, and get plenty of sleep. Consider walking, jogging, swimming, gardening, or another activity that you enjoy. Sleeping well is important for both your physical and mental well-being. If you are having trouble sleeping, talk to your doctor about what you can do. Now, there are some alternative medicines. Alternative medicine is the use of non-conventional approach instead of conventional medicine. Complementary medicine is a non-conventional approach used along with conventional medicine, sometimes called integrative medicine. Make sure you understand the risks as well as possible benefits if you pursue alternative or complementary therapy. Do not replace conventional medicine treatment or psychotherapy with alternative medicine. When it comes to depression, alternative treatments are not substitute for medical care. And now I'll tell you some supplements, but generally we do not recommend because these are not FDA approved. Anyway, I'll tell you. These are St. John's wort. Although this herbal supplement is not approved by Food and Drug Administration to treat depression in the United States, it may be helpful for mild or moderate depression. But if you choose to use it, be careful. Because St. John's wort can interfere with a number of medications such as heart drugs, blood thinning drugs, birth control pills, chemotherapy, HIV/AIDS medication, and drugs to prevent organ rejection after a transplant. Also avoid taking St. John's wort while taking antidepressant because the combination can cause serious side effects. Another group is SAMe. This dietary supplement is a synthetic form of a chemical that occurs naturally in the body. This is also not approved by FDA to treat depression in the United States. It may be helpful, but more research is needed. SAMe may trigger mania in people with bipolar disorder. And then another group is omega-3 fatty acids. These healthy fats are found in cold water fish, flaxseed, flax oil, walnuts, and some other foods. Omega-3 supplements are being studied as a possible treatment for depression. While considered generally safe in high doses, omega-3 supplements may interact with other medication. And more research is needed to determine if eating food with omega-3 fatty acids can help relieve depression. I mean, these omega-3 fatty acids are generally safe drugs, but they can interact with other medication if given in higher doses. Okay, and more research is needed for this. Nutritional and dietary products are not monitored by the FDA the same way medications are. You cannot always be certain of what you are getting and whether it is safe. Also, because some herbal and dietary supplements can interfere with prescription medications or cause dangerous interactions, you should talk to your doctor or pharmacist before taking any supplements. But generally, we do not recommend these supplements. Okay, it's better to take this therapy recommended by your doctor and psychotherapy as part of your treatment. Okay. Now there are some other things which I should tell you. These are known as mind-body connections. Integrative medicine practitioners believe the mind and body must be in harmony for you to stay healthy. Examples of mind-body techniques that may be helpful for depression include acupuncture, relaxation techniques such as yoga or tai chi, meditations, guided imagery, massage therapy. Massage is really helpful. Okay, music or art therapy. Well, in my channel you can find some music therapy videos because I consider these as a part of treatment, and it's a proven benefit of music therapy in so many conditions, especially mental related conditions. So you can watch the music therapy videos in the separate playlist of music therapy in this channel. And also you can use spirituality and aerobic exercise. Well, I hope you like this video, and till now if you have not subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And I think my videos, because I see your comments, I think my videos provide some benefit to the people, and that's why they like my videos and they ask questions. So if you think that my video provides some sort of benefit, even if it is a little bit benefit, please like the video and share my videos with your family and friends. Okay, and also if possible share these videos on social media such as Facebook and Twitter. Actually, this channel Hube Tabibi is created to help humanity all over the world. So I want my message to be conveyed all over the world so that I can help people who are suffering from different illnesses, because the main objective of this channel is to give you an honest approach regarding different illnesses and how they are treated. I am a doctor myself and I have been treating so many patients successfully. So I advise you to please share this video with others so that you can also help humanity. Thank you very much. See you in next video. Bye.